Hi, this is Shelley Kraft, and welcome to SNNLive. We're at the AdvaMed 2011, also known as the MedTech Conference, and we're here in Washington, D.C., our nation's capital. I have Bob Schmidt of Great Lakes Neurotechnologies. Let's go. Tell me what you do.
Well, thank you, Shelley. What we do is we have developed and sell a device that allows people with Parkinson's disease or other movement disorders to be able to be diagnosed and then to monitor their treatment. Because these diseases, when they're treated with drugs and also with neurostimulation devices, the body goes through what's called acclimation. And so what was the proper dosage previously becomes usually not enough after a period of time. And so you need to be able to continually update your medication. So
there are so few new things out on the market for Parkinson's. So how new is this?
Well, we just introduced it last year. It's currently being sold in the United States and around the world. It's just a little finger device. And what it does is it's sent home by the neurologist with a little iPad-like device that shows movies to be able to do the different uniform Parkinson's disease rating scale tests. And the patient may do this 6 or 8 times a day to be able to see how they're doing during the course of the day. And so this little screen kind of beeps at you to say it's time to do your tests. So you go through this few minutes of tests every day and then monitor the amount of tremor. And so there's different tests which show whether the medication you're on is properly treating that type of tremor. Or at the time of day, if you have all red blocks going across at 4 o'clock, maybe you need a new dosage at 3 o'clock. So on our website at glneurotech.com, you can see a little movie where the doctor says, me trying to prescribe medication for a patient in the 10-minute visit I have with them is like you looking at one frame of this movie and describing the entire film. So that's what we do, is provide this several-day testing so the doctor can then better evaluate what the drug therapy or neurostimulation therapy should be.
What else is there besides L-Dopa?
Well, there's a number of different drugs on the market, but L-Dopa is primarily was the mainstay drug for all of this.
So in other words, we can give this to a Parkinson's patient, just put it on their finger, and they self-monitor how bad their tremors are, if they need to have a greater dose, lesser dose, or is there a cocktail also involved?
Well, there can be for the therapy, and that's up to the physician. But what this does, it's a little kit that goes home with the patient to be able to do this testing, and then it comes back to the doctor, who gets a report out of the system that then shows each type of tremor and all the times of day that they've been tested for, and it goes from a green to a yellow to an orange to a red block to say this is a problem. If the doctor doesn't particularly thinks there's something wrong, he can just press on that dot on the screen and be able to get a video, because it's taking a video of all of this. And then if he still wants more data, he can press on it again to be able to get the data showing the raw data for the accelerations and the gyroscopes contained in the device.
Website, one more time.
glneurotech, neurotech.com.
Ladies and gentlemen, Bob Schmidt, an expert in the area. Thank you for coming on to SNNLive.
Thank you very much for having me.
Quite welcome.